black tips to its nose, to its ears, and to its feet. So think of it as looking like a Siamese cat. Okay, Siamese cats have these black tips, and that's what I tell our students. That's how I tell our students to remember it, because or not most, but a lot of our students haven't done much horse work, but they've done a lot of small animal work. So it's an easy way for them to remember it. So if it has black tips on its ears, and its nose, and its feet, then it's going to be a bay.
The white.
Is it white?
The white.
We do have white there, but you can see the black goes up to there and then it becomes brown. So if you have those markings, black, what we call black points, okay, then it's a bay. One of the sort of useful things you can do is if you are sort of a little bit worried about colours and markings,
and breeds as well.
And breeds as well, yep. There's a very, very good book produced by a company called Weatherby's, which is spelled W-E-T-H-E-R-B-Y-S, and it's called Weatherby's Guide to Identifying Horses, and you can get that on the internet. It costs £5, and that goes over all the colours with you, and also all the markings as well. Okay.
Will we be asked different colours and breeds?
Quite possibly, yeah. That might be the first thing they ask you as an easy question to get you put you at ease. So
is there any like?
To describe the horse and be like, can you tell me this horse?
Yeah, they could do, yeah.
Is this the common colour then, and the breeds in the?
This is a common colour and a common breed for this part of the country. You know, they could give you a thoroughbred, or they could give you
Arabian. We have Arabian.
Arabian, yeah. There you go. We've got Arabs are quite popular as well. Arabs have a sort of what we call a dished face, so they have a sort of doming bit of their head, a very distinctive head. Thoroughbred, yeah. Thoroughbreds are just much finer looking. They'll often be a similar colour to this. They're slightly taller, but much finer. They're not as wide. So these small, stocky ones are what we refer to as cobs.
So this cob is crossbred then,
Yeah.
as opposed to thoroughbred, which is
thoroughbred's purebred. This will likely be a crossbred.
And what about standard bred?
C-O-B?
C-O-B. Yeah.
And the standard?
Standard breds, slightly bigger than this.
It's also purebred, isn't it?
Yeah. So what we're going to do, guys, is I say we'll get you doing the horse marks and things later, but I'm just going to talk through the clinical exam. Wait, stop it. You're biting. The clinic, don't hit them in your exam, by the way. Okay. The clinical exam will actually, if you do it thoroughly, it will take up a good sort of 5 minutes or so of the 15-20 minutes that you've got. Alright, so you're less likely to get asked tricky questions. The clinical examination also is basically your sort of tools in every situation for trying to identify what problem is going on. And it's probably the single most important thing that you can do. So you need to know what you're doing and be confident about doing it and the interpretation of findings. Alright. And what I want you to do is, during the exam, is actually to talk through your examination to the examiner. Do not do it in silence, okay? Because they often don't like that. So what we'll do is, I would start at the head end. So first of all, check the mucous membrane colour, pink, moist, capillary refill time of less than 2 seconds. Okay? I would then move to the mucous membranes of the eyes. Let's have a look at those. Pink and moist. Capillary, well, you're not going to do a capillary refill time in those, but pink and moist, so you would say that. Have a feel at the lymph nodes, okay? So I would say I'm now feeling for the submandibular lymph nodes to make sure that these are not as large. I would then palpate the parotid glands, the parotid lymph nodes and salivary glands is here. And then what I would do is I would look to move on to just checking that the jugular vein is patent, there's no sort of thrombophlebitis there or collapsing of the jugular vein. So all we do is stick your thumb in the jugular groove and you raise it, and you can see the vein bouncing away there, and you do that on both sides. Okay.
Sorry, just with the parotid gland, just differentiating it from the retropharyngeal.
Sorry, yeah, parotid salivary gland and retropharyngeal lymph
Right.
nodes. Sorry, too early in the morning for. Yeah, so your retropharyngeal and your parotid salivary glands as well. We feel them.
Where is parotid?
Parotid.
Is it below?
Parotid is just going to be in there, and your retropharyngeals is up there. So sometimes what we find in this country, when we've not got the snow and the horses are eating a lot of grass, is that the parotid salivary glands will often swell up quite markedly. It's just something called grass glands. Clients often get a little bit worried about it because they think it strangles. It isn't. All it is that there's an excess production of saliva, and it's a bit like you eating something very sour. You get that sort of funny feeling just sort of there where your salivary glands are. Then what I would ask you to do is to move on to auscultate the heart. Okay, so we need to, just behind the sort of elbow and the triceps sort of mass, you need to push your stethoscope in. I like to auscultate the heart for a full minute, and I would encourage everybody to auscultate the heart for a full minute. I do every system for a full minute, okay? And the reason I do that is just to be as thorough as I possibly can.
Excuse me, you take the landmark of the elbow joint for the heart?
Yeah, well, just in there, yeah. Just you listen for the apex beat, which is the loudest beat, which is just going to be very, very close to where that elbow is on the chest.
Right.
You'll hear it straight away when you put your stethoscope on. It's very, very obvious. Then what I would do is obviously listen to the heart for a minute. Say what the heart rate is. The normal heart rate, roughly, going to be sort of like 24 to 36 beats a minute. Okay. Obviously that can differ depending on the size of the animal. A very, very small pony may have a slightly higher heart rate, but that's just a rough guideline for you. Then what I would ask you to do would be to auscultate the lung fields. So make sure you get a good listen there, again for a minute. Things that are important when listening at the lungs are going to be respiratory rate, which should be between 8 and 12 breaths a minute. Watch to see just how much effort has been put into the breathing. You know, is the horse really struggling to breathe, or is it rapid, shallow breathing? Can you hear any abnormal noises? Okay. Now, it may be that you know that there are some abnormal wheezes or crackles going on there. Normal horse lungs should be you shouldn't hear anything on them. Okay, so when you listen at them, they should. I just always describe them as the Rolls Royce of lungs. All right, they just don't make a noise. They're very, very quiet. If you were to hear noise on the lungs, what you could do is to make sure it wasn't referred noise from the windpipe. You can listen at the trachea or the windpipe, just because sometimes you'll get little pockets of fluid which are sat just at the thoracic inlet where it bends, and that's an area that sometimes we have to sample for fluid as well. Okay.
Where is that area located?
Just down there. Okay. I tend to only listen at that if there is something abnormal on the lungs. Okay. If there's not, it's not an area I would routinely listen to, so I would encourage you guys to do the same. Okay. The guts. What we need to do with them is there are 4 quadrants. Now these should all be listened to for a minute each time. This is quadrant number 1. Quadrant number 2, and then on the other side we have 3 and 4. Okay, we'll go around to the other side and go over that again. So I would listen at each of these for a minute, and you should be hearing the normal haustral and peristaltic sounds, these sort of continuous sort of gurgling sounds that you'll be hearing. Obviously you relate your clinical symptoms to the condition that you're suspicious of. You know, if it's a colic, for example, you know, are the guts abnormally quiet? Are they abnormally loud? Is there periods where they're very quiet and then become very loud, such as in a spasmodic colic? These are all important things. So if we want to come around to the other side, this horse is just enjoying the sunshine today.
So you know the limbs, right?
We do the limbs, yeah, I do them at the yeah. I have a very, very set routine for doing this, and that's just so I don't miss anything. Then what I would do is get quadrant 3 and quadrant 4. Now if you remember, we have our cecum sat up here, and that should sound like a toilet flushing once a minute. Okay.